All right, travelers, let's talk about malaria and dengue and the differences between all of that good stuff here. So, a guy comes back from Brazil with a fever, anemia, and a blood smear, and it shows a ring-shaped parasite in a red blood cell. That's Plasmodium vivax. And so, if you don't treat the dormant liver stage with primaquine, then he'll be back in a few weeks with the exact same symptoms. Only Vivax and Oval have the sneaky hypnozoite stage hiding out inside of the liver. So, chloroquine hits the blood, primaquine clears the liver. No primaquine, no peace. That's a good way to remember that. So malaria isn't just about the mosquito bites. There's the Scheisent stage, and that's key to understanding for the relapse potential and disease progression, especially in the Vivax and Oval. And so here, let's just talk really quickly about the life cycle. So you got a mosquito who's the vector, the female Anopheles mosquito, and it transmits the sporozoites into the human bloodstream when it chomps on you. And the sporozoites travel in the liver and they infect the hepatocytes, right? And the sporocytes mature inside the liver, and the liver cells called Scheisents. And these Scheisents they're going to rupture and they're going to release the merozoites. The merozoites then once the red blood cells and begin the blood stage of the infection. So the hypnozoite is the dormant stage in P. vivax and P. oval. And so some sporocytes go dormant as the hypnozoites and liver cells, and they can reactivate weeks and months later, and the relapse will happen unless you're treated with the primaquine. And so the merozoites infect the red blood cells, and inside the red blood cells, they form the trophozoites, the ring-shaped guys that you'll see on the blood smear, and the Scheisents again later in the stage with multiple nuclei. And the red blood cells will rupture, and you'll get the fever, the chills, anemia. So some parasites become gametocytes, which are then picked up by another mosquito during blood meal, and it continues the cycle. It just goes on and on and on and on and on. And so basically, a mosquito bites you and infects you with sporozoites, goes to your liver, and then it matures to Scheisents. And then these rupture and unleash the merozoites in your blood. And now the red blood cells get infected, and boom, you got the fevers and the chills. So the Vivax and the Oval. Okay, so those guys are the sporozoites that hide out as the hypnozoites in your liver, and they wake up with a relapse unless you treat with primaquine. So there we go. That's the life cycle of the mosquito. That's what you got to know when it comes to this disease. And unlike the Plasmodium falciparum, the eradication of the Plasmodium vivax and Oval requires primaquine. That's the big kicker there. So yeah, hopefully this was helpful. There are 4 major Plasmodium species that cause malaria. There's the falciparum, the Vivax, the Oval, and the Malariae. And the most common, the most cases worldwide are due to falciparum and Vivax. And in Brazil, the dominant one is Vivax, 90% of them. Okay, well, anyways, hopefully this was helpful. And if it was, go ahead and like and subscribe and all that good jazz.